Hi everyone. Hope all of you have done the exams really well. And I'm very happy from radiology side. There were around 10 questions, and almost all the questions were easy compared with other subjects. And most of the questions were asked from the topics which we have already discussed again and again in our classes as well as in our test series and in our daily PVQ sessions. So let we quickly go through the questions which has been asked. So this is actually one question which they directly asked. Eye of tiger sign seen in MRA in which disease? So eye of tiger sign is seen in a condition called as Hello-Warden-Spatz disease. We have already discussed in our class. It is seen in a condition called as Hello-Warden-Spatz disease. That disease is because of the deficiency of pantothenate kinase associated enzyme. So when the pantothenate kinase enzyme is deficient, it will result in pantothenate kinase associated neurodegeneration. So the answer is PKAND or pantothenate kinase associated neurodegeneration. Now, we already discussed about Wilson's disease. In Wilson's disease, we will classically get the panda sign. Krabs disease is different. Okay, we have discussed about Krabs disease when we discussed about the demyelination of pediatric age group. Okay, Huntington's disease classically presents with boxcar ventricles. Okay, so here the answer is B, pantothenate kinase associated neurodegeneration. Second question is something that is very simple and almost everyone know the answer, because which imaging modality is absolutely contraindicated in pregnancy? So we start the session of radiology by telling about radiation and its hazards. So we know which all investigation containing which are the investigations containing ionizing radiations and which all are the investigations containing non-ionizing radiation. So pregnant women should not be exposed to investigations that require ionizing radiation. So CT scan is an absolute contraindication for a pregnant woman. So the answer is CT scan. Now, this is actually a little tricky one because they gave you an image of a lytic lesion in skull and they asked you from which thyroid malignancy you usually get a large lytic metastasis in skull. So we know the two main types of thyroid malignancy. One is papillary carcinoma thyroid and another is follicular carcinoma thyroid. So papillary carcinoma thyroid has high predilection to spread into the adjacent lymph nodes, whereas follicular thyroid carcinoma has predilection of hematogenous spread. So here the answer is follicular thyroid carcinoma, because these hematogenous spread will go and get deposited in skull, resulting in large lytic lesions in skull. So during our class sessions, we have already discussed there are two types of metastasis. One is osteoblastic metastasis, another is osteolytic metastasis. Osteolytic metastasis is the most common type of metastasis, whereas osteoblastic metastasis is commonly seen in conditions like prostate or breast or transitional cell carcinoma of urinary bladder. So here the answer is follicular thyroid carcinoma. So this is actually a repeat question from last INA. So when we already know what is the investigation for your renal calculi or ureteral calculi or any calcification, the investigation of choice will be a non-contrast CT. It is not a contrast enhanced CT. The investigation of choice will be a non-contrast CT. So here the answer will be NCCT KUB. Because if you give contrast, you will get confused whether it is a calculi or whether it is the contrast medium. So remember, for any calcification or any calculi or bleed anywhere, CT, NCCT, plain CT will be the investigation of choice. Now, this is also a question which already they have asked during previous year exams. So when we discussed this in our class, I already told you in 2023 also they asked something related to parathyroid. So parathyroid is one of the favorite topic of INA exams. So best imaging modality to locate parathyroid adenoma. So the answer is straightforward. It is technetium 99M system B scan. So the answer is system B scan. So that is actually a topic we have discussed again and again in our nuclear medicine classes. Now, this is actually a tricky one, usually, which is a topic that is not regularly taught in the sessions. Honda sign. Okay, Honda sign is a sign which is classically seen in bone scans, but can be also seen in still images of MRI. So, either in still images or in bone scan, you will be able to see the Honda sign. Honda sign is due to sacral insufficiency fracture. So, when there is a sacral insufficiency fracture, you will get the classical Honda sign. So, this is actually something new which came up in exam. Remember, every year they will ask something new so that it will be a little bit tough for the above average students. So they will come up with something which is always new. So that is normal. So remember, ondasign is seen in sacral insufficiency fractures. So this was one question which we have already discussed in our neuroradiology. And when we discussed, I told you this is very, very important because every year they keep on asking you about neurocystic cirrhosis or tuberculosis. So the history will be the complaints of headache or seizure or something like that. But the image matters. And if you're able to see a scolex, then you have to go for neurocystic cirrhosis. And if you're seeing conglomerate lesions showing intense enhancement or lipid lactate peak, then you have to choose tuberculosis. When I discussed with many of the students, most of them were telling that there was a scolex visible within the lesion. So if you are seeing a scolex, then the answer is neurocystic cirrhosis. So you have to be very, very careful while looking into the images. You should read this, you should understand this thoroughly, then you have to practice this before going to your NEET exam. Okay, so neurocystic cirrhosis, tuberculosis, cryptococcus, as well as encephalitis like HSV are very, very important for INA as well as for NEET exams. This was another question which requires a simple logic common sense for getting into correct, because most of the students were telling there was an X-ray image with barium or contrast in rectum. So if you're seeing an X-ray image with contrast in rectum, you have to understand that that is X-ray study. So it is not an MRI study. It is not a barium swallow because we are seeing a rectum, not an esophagus. So you have to understand the anatomical part. You have to realize whether it is a CT or X-ray or MRI by looking into the images. So students were telling that the lateral view was very clear. The spine was seen, sacrum was seen very beautifully. So most of them were convinced that this is X-ray defocography. So if the image looks like this with the sacrum is visualized well like this, and there is a contrast filled loop anterior to sacrum, that is rectum. So this is defecography. So defecography can be done with CT or MRI as well as X-ray. Usually we will do under fluoroscopy, but that is under X-ray defecography or sometimes MR defecography. Okay, CT is not routinely done. Now, there was a question where patient had chronic history of abdominal pain around 8 months. There was history of pancolitis. I guess some of them were telling there was a word called pancolitis in that. So when you are dealing with pancolitis, chronic abdominal pain, diarrhea, and when you are seeing a hostral loop, some of them were telling that there was dilated a hostral large bowel loop was seen. So you know the large bowel loop is most commonly involved in ulcerative colitis. In Crohn's disease, usually the ileum, distal ileum, there will be skip lesions. The presentation will vary. But in ulcerative colitis, you will be able to see a hostile thickened large bowel loop. Okay, so this was a case of ulcerative colitis. And again, there was a question regarding sunburst pattern. And around 17-year-old male with the history of pain and something was there. And there was X-ray description of sunburst pattern. So when you hear the term sunburst or Codman triangle, you should understand that you are dealing with osteosarcoma. You should understand that you are dealing with osteosarcoma. And if the examiner is telling you that you are dealing with a lesion with onion peel type of periosteal reaction, then it will be Ewing. So all these things we have discussed when we are discussing about bone tumors in the class. So please go back and see the workbook, how to differentiate between osteosarcoma, Ewing sarcoma, chordoma, like all the tumors. Okay, all these tumors are very, very important. So before NEET, you should be very thorough in all the bone tumors, whether it is a benign entity or a malignant entity. So don't feel bad for getting one or two wrongs. Okay, you have to learn from your mistakes and make sure you are not repeating the same mistake in the upcoming NEET exam. There is only 25 to 27 days remaining for the upcoming NEET. So prepare well, prepare aggressively. Don't give any chance for recall or risk. Study hard. I wish you all the very best. Good luck.